often does your job call you out of bed in the middle of the night? Well, if you were a doctor, it would be often. And generally, there isn't much time to spare.
Coffee, Doctor?
Oh, fine. Have a Camel with your coffee.
Thanks.
You know, this night work's kind of rough, isn't it?
That's right. But a Camel's always a pleasure.
Yes, folks, the pleasing mildness of a Camel is just as enjoyable to a doctor as it is to you or me. In a nationwide survey, doctors in all branches of medicine were asked, "What cigarette do you smoke, doctor?" The brand named most was Camel's. Tens of thousands of doctors, general practitioners, surgeons, specialists, doctors in every branch of medicine were included. And according to this nationwide survey, more doctors smoke Camels than any other cigarette. Try Camels yourself, the cigarette so many doctors enjoy.
This commercial is representing the era when more than 40% of adults smoked or used other tobacco products. Since the first Surgeon General's report on smoking and health in 1964, there have been more than 20 million premature deaths attributable to smoking and exposure to secondhand smoke. Even though the prevalence of current cigarette smoking among adults has declined from 42% in 1965 to 18% in 2012, smoking remains the leading preventable cause of premature death in the United States. 1994 and 2012 Surgeon General's reports on smoking and health indicates that majority of all cigarette smoking, up to 88%, begins before the age of 18. Among young adults, 36.6% of males were currently smokers, and 27.1% of females were currently smokers. Whites had the highest prevalence of current smoking at 36.6%, followed by blacks at 26.2% and Hispanics at 25%. Smoking is the more common in young living below the poverty level at 7.6% than it is in those living at or above this threshold at 6.2%. Smoking and other tobacco products affects all organ systems in the body. Primary smoking is causally linked to many devastating diseases such as lung, oropharyngeal, bladder, kidney, colorectal, esophageal, pancreatic, and liver cancers, pulmonary diseases, cardiovascular diseases, reproductive and erectile dysfunction and congenital defects, and other chronic conditions such as diabetes, immune system dysfunctions, rheumatoid arthritis, cataracts, and periodontitis. Secondhand smoking produces several health consequences in adults and children, which many times overlooked by healthcare providers. In children, it's causally linked to middle ear infection, increased respiratory problems occurrence, impaired respiratory function, and sudden infant death syndrome. In adults, it increases risk of stroke, coronary artery diseases, and lung cancer. It also causes nasal irritation and affects reproductive function in women. Nicotine and other chemical compounds in tobacco products produce several adverse effects that lead to pathogenic process in the human body. After inhaling of tobacco smoke, oxidative stress occurs that leads to endothelial damage and causes inflammation. At the same time, nicotine suppresses normal immune response. Persistent inflammation results in endothelial injury and dysfunction, which leads to respiratory and cardiovascular problems. Chemical properties of nicotine attributes to atherogenic lipid profile, insulin resistance, and increased risk of thrombosis. At the same time, constant oxidative stress damage DNA and suppress normal cell cycles, causing malignant cell formation that cannot be stopped by altered immune response. There is a nonlinear dose response between exposure to tobacco smoke and cardiovascular risk, with a sharp increase at low level of exposure because of dramatic increase in platelets aggregation. Therefore, it's very important to clear the misconception in your patients that just few cigarettes are not going to hurt. Indeed, they are. At the same time, the use of nicotine patches and other medications to facilitate smoking cessation in people with known cardiovascular disease produce far less risk than the risk of continued smoking. The most important message that you can tell as a nurse to your clients: there is no risk-free level of exposure to tobacco smoke, and smoking cessation is the only proven strategy to reduce the pathogenic processes related to tobacco exposure. There are many health benefits of quitting smoking, such as reduced risk for lung cancer and many other types of cancer, reduced risk for stroke, heart disease, and peripheral vascular disease, reduced respiratory symptoms and risk for acute lung disease. Also, it's reduced risk for infertility and low fetal birth rate. It's our primary obligation as nurses to educate our patient about health risks and benefits of quitting to enhance knowledge-based decision about smoking cessation. For this purpose, healthcare providers can use printable materials or visual aids to reinforce smoking cessation. Another resource that can be used is tips from former smokers. In March 2012, the Center for Disease Control and Prevention launched the first ever paid national tobacco education campaign, Tips from Former Smokers. The Tips campaign profiles real people who are living with serious long-term health effects from smoking and secondhand smoke exposure. The key messages of Tips are: smoking causes immediate damage to your body, which can lead to long-term health problems. For every smoking-related death, at least 30 Americans live with a smoking-related illness. Now is the time to quit smoking, and if you want help, free assistance is available. This is a Becky story.
Hi, I'm Becky. I started smoking when I was 16. I thought it would make me look so cool and feel so free. Now I have end-stage COPD, and I've had lung surgery, and I'm chained to an oxygen tank. My tip is, if you keep smoking, your freedom may only go as far as your oxygen tube.
You can quit. For free help, visit cdc.gov/tips.
As noted earlier, Caucasian males are more likely to use tobacco than any other group. But a study noted in Oncology Nursing Forum indicates females are 95% more likely than males to be screened, and African Americans are 95% more likely to be screened for tobacco use than any other ethnic group. According to the same study, tobacco use is only screened for by about 70% of healthcare providers. Adult nurse practitioners screen for tobacco use more than any other healthcare professional. Also, patients who receive care at facilities who accept Medicare, Medicaid, and CHIP are more likely to be screened than those who do not. Our statistics and screening trends both indicate we need to make changes in the way we screen people for tobacco use. 70% of healthcare providers' screening is not enough. A realistic goal would be to increase our screening rate to 80%. How do we do this? The number one way to increase our screening rate is through the development of therapeutic relationships with our patients. Therapeutic relationships help foster trust and communication. As nurses, when we have a non-judgmental attitude and truly display an interest in our patients' health and well-being, we are more likely to get accurate information regarding tobacco use. With the development of therapeutic relationships, patients are also more likely to be receptive to information provided regarding cessation. Times they are a-changin', and so is the way people use tobacco. Not only should we be screening for cigarette use, but also for the use of e-cigarettes, hookahs, and dissolvable tobacco. Earlier we said most smokers have their first cigarette before the age of 18. Well, the 2014 Surgeon General's report indicated during 2011 and 2012 the use of e-cigarettes nearly doubled among middle and high school students. We need to make sure pediatricians and other medical professionals who provide care to children and adolescents are on board with the need for increased screenings and aware of cessation programs within the community. We need to make sure screening is done to include specific tobacco products like hookahs, e-cigarettes, and dissolvable tobacco. Tobacco can be absorbed into the body in a number of ways. For example, through the digestive tract by way of nasal sprays, chewing tobacco, and nicotine gum. It can also be absorbed transdermally through patches and through the respiratory tract by various smoking methods. Nicotine itself has a very short half-life of about 40 minutes, so it's not detectable in the body system for long. However, cotinine is the primary metabolite of nicotine and is detectable for about 4 days after exposure, which makes it the best biomarker for tobacco exposure. In an article from the American Journal of Public Health, it states that lead is a tobacco constituent and can be measured in smoke exhaled by the smoker and in smoke from the burning cigarette. This article also states that as blood cotinine levels rise, the level of lead in the blood also rises. As we all know, lead can have lifelong negative neurologic effects on children. Some target assessments are as follows. With recent tobacco use, blood pressure and heart rate rise. Weight loss is also a common phenomenon among tobacco users. Many, but not all smokers, smell like smoke for some time after smoking. Tar-stained teeth and fingers, as well as premature skin aging, often indicate tobacco use. With smoking, individuals have an increased mucus production, which leads to an inhibition of the mucociliary escalator and a persistent cough. Desmosine and isodesmosine are specific degradation products of elastin and can be measured in the plasma and urine. Studies have suggested that urinary desmosine levels are increased in response to both cigarette smoking and to COPD. Smoking has also been associated with higher LDL levels and elevated thrombin levels.